This is Duke, a quarter horse gelding. He's only 15 years old according to a vet, but he is a rescue horse and must have had a pretty rough lifestyle. He can barely walk and seems to be in a lot of pain. The most obvious sign of his neglect were his feet. The farrier came the next day after his arrival, and that was after the first trim. The angle of his hoofs was way too long, and that caused a lot of strain onto his back. Looking at his face, there were clear signs of abuse. There were bony scars from having a chain over his nose, and he was terrified from halters and end of lead ropes. His eyes expressed all the terror he must have suffered, and they're full of fear and worry and distrust. The neglect and abuse clearly marked Duke's body. He has an acquired swayback where the spine is hanging through. There's not enough tension in his abdomen coming from malnutrition, lack of exercise, lack of comfort. And that creates pressure onto the sternum, which kind of pushes forward into his front legs. Also, having hoofs which were not trimmed properly, which were too long, forces the horse to stand further out, which also starts putting extra pressure onto that spine and allows the spine to easily compress. Health issues which do not get addressed over a longer period of time will show themselves in the physique of the horse. You can see that Duke has less muscles on the left side of his shoulder. It's a clear difference between right and left. You can also see that muscles are just wasting away, and when I looked at his right hind leg, it's almost like a whole area of muscles is missing, and looking from behind you can see that that left side is looking way healthier than the right side. Also, he carries that tail constantly to his right side, and comparing this line of the spine shows that all comes from the spine and has a connection from the front to the back. It took a long time to take Duke out of his stall and walk him down to that arena. He stopped every few meters and needed to rest and is clearly in pain. He walks a little bit better on the sand and on the uneven grass, and when you see him lying down here, he lets that whole backside drop. He cannot bend his back, and his spine must be very painful. I did not even expect him to be able to roll anymore, but he has a lot of sensitivity, and I'm gonna just take a look with my skills and see what I find and what options we have to treat him. There's a lot of weight on that forehand, and you can see it's almost overdeveloped, that whole neck, so it's compensating for the issues he has in his back. When I'm observing Duke a little bit closer when he moves, you can see that there are muscles on the top of his neck which are way too tight. There's a bulging cervical vertebra further down his spine. And then there's real holes and attachments around his shoulder and knee joint. Before I started working with him, I just wanted to get an idea how he feels, how he reacts, and I turned him loose into a big arena, and he just wanted to stay in my space, and he is glued to my side, almost like I've practiced with him months of liberty work. But it's cute, but it's a sign that he is very insecure, and that's a behavior you would normally not tolerate from a horse, but he's kind of pushing into my space and worried and really likes company and needs to be close. I addressed him very slowly and super gentle. I barely touched his back, and as soon as I just touched, he moves away. There's no way, even though he likes to be close with his head, but he moves the rest of his body as far away from me as possible. So all signs of being very sensitive and very sore. It was even hard to figure out where to start working with him, so I didn't want to touch areas which are super sensitive. There was a lot of tension in his jaw and his paw, so I kind of started slowly tuning into his energy field and into his neck and jaw. He was super reactive. On the other hand, had a really hard time to let go. There was barely any lick and chew, so there's a lot of tension here. It's the first time he kind of brings his head down a little bit. He put most of his weight into his right foreleg, and when I worked on his shoulder blade and addressed infraspinatus, supraspinatus, and hit some of those trigger points, he every time lifted his left front leg. It was not possible to make him stand on that left leg and lift up his right. He would just not give me his leg. So a clear sign that that left shoulder is a strong issue for him and that he has problems with that forehand. The front part of his body had to compensate for all the pain and the stuckness in the back. There was no motion in his sacrum. The vertebrae in the mid-back and the lower lumbar section were super sensitive and stiff. But he didn't even like too much of a bend with his neck, because that translates into that mid area. Here he gave me a little bit of motion and release in his paw, but he was very careful and gave me only once in a while a lick or a chew, so very difficult for him to let go, because he needed all that guarding in order to go through his life. Dukkha is definitely a very advanced form of swayback and chronic back pain and issues, to a point where it's going to be very difficult to bring him back to comfort and ease. And I help him just loosen up his neck and his spine, and I would start creating slowly, a little bit more and more motion to make him feel better. And I tried to address his abdominal muscles and the diaphragm. He didn't like it. He kicked me there one time. First I thought it was maybe a fly, but then he did it a second time. So there's a lot of soreness in his body, and he has a lot to say to me here. The nuchal ligament of the neck turns into a ligament called supraspinous ligament. It runs along the top line of the back and connects the tips of the spinous processes of the spinal vertebra. There's also a ligament in between the bodies of the vertebra, which is called interspinous ligament. So if that supraspinous ligament is way too tight, it holds the tips too close together and stretches the ligaments in between the vertebrae, which create then ligament sprains at the bottom and too tight vertebrae on top of the spine. Right after my session, the vet showed up and x-rayed the spine of Duke.
Normal, okay-ish, close, kissing, overlapping, fused.
Duke got diagnosed with a severe form of kissing spine. He had more than 10 vertebrae which were touching or fused, and there's not much they can do for him anymore, and so it got decided that he needs to be put down in the next couple days. I decided to make a video even though that treatment is not going to make any difference in Duke's life, but I hope that his suffering can make a difference in many other horses' life. I started reading up on kissing spine and found out that in the literature over 40% of horses actually show kissing spine in images, and post-mortem studies even correct that number and raise it up to 90%, meaning that the narrowing of the vertebrae in the back of a horse can actually be non-symptomatic. What I think is most important is realizing that a condition which can be treated if you start working with the horses early on, when you pay attention to the shape of their spine and when you start taking the practical advices you hear, like feeding enough protein, feeding them off the ground, having more grazing time, use appropriate rider weight, feed your saddles, give them enough exercise, and teach them how to elongate the top line and how to engage the bottom line. Regular exercises like belly lifts or carrot stretches to the side and in between the legs, and pelvic tilts or even walking backwards can help them to engage the right muscles and to early on counterbalance that tendency of that swaying back. Let's hope that Duke's suffering was able to create a little bit more awareness for the disease of kissing spine and for the possibility to start working on it early on before it gets to a point of no return. Duke was spending his last few days on a pasture with a little mare and could pass peacefully.